This happened a while ago.
Hi, my name is Sandra Samuels, host of Boss Lady Live, where I come to you every Monday night with experts to discuss issues of crime and violence, love and relationships, health and wellness, various different topics that affect us right here in Jamaica. Please like and share and subscribe. Click on the notification bell to be advised when you're on. See you then.
Good evening, good evening, good evening. Once again, it's Boss Lady Live. It's Monday, May 3rd. And this evening, like any other Monday evening, we are here to discuss topics that are important to us right here in Jamaica and the rest of the world for that matter, because we are on an international platform. This evening, we'll be speaking about how much do we really know about the sickle cell disease? This evening we have three persons who will share not only their knowledge about sickle cell, but their experiences with sickle cell. So this evening, let me introduce my, I don't want to say panel, but my guests, my esteemed guests this evening. First, let me introduce Professor Monika Asnani. Did I do that right? Professor Asnani, she's a professor of family medicine and epidemiology at the Caribbean Institute for Health Research, the Sickle Cell Unit, University of the West Indies, UWI, in Jamaica. She has over 18 years experience of providing clinical care for persons with sickle cell disease, SCD. Her focus of research is 1, psychosocial outcomes and determinants in SCD, and 2, sickle cell nephropathy. Her work has advanced understanding of predictors of renal function decline in SCD, and has sought to validate methods to determine presence of early sickle nephropathy. She has validated and tested various tools to examine quality of life in children, adolescents, and adults with SCD in Jamaica. She is currently leading a project to assess the prevalence of neuropathic pain in SCD and is the local PL for the gene therapy in the SCD project. She is a graduate of the UWI and was awarded the Hbss degree in 1992. Her thesis for DM, Family Medicine, in 2006 examined the quality of life of patients with SCD. She completed in 2014 her PhD in epidemiology, epidemiology, with a focus on the epidemiology of sickle nephropathy. Why these tongue ties, right? And then we have a warrior, Kerri-Ann Sanderson of sickle cell. Kerri-Ann, otherwise called Chrissy, was diagnosed with full-blown sickle cell disease from birth. It is survivable, right? And then we have Mrs. Andrea Hall Brown, who is the mother, well, many of us know of Shakira Martin, who was Miss Universe in 2011, you said, right? 2011. And she did a lot to expose sickle cell. So I want to welcome my guest tonight, and we'll start with Prof Asnani. Welcome.
Thank you so much. Good evening, Sandra, Kerri-Ann, Andrea. Good to be with all of you.
And so we want to start, Doc, with you because we want to know exactly what is sickle cell disease.
I'm sure Andrea and Kerri-Ann could probably say that better, but I'll give you the medical viewpoint. Sickle cell disease is a genetic disorder. And a genetic disorder means it's an ailment, an illness, a disorder that you're born with. You cannot get it later in life. You cannot get it through a blood transfusion. You can only be born with it. Important myth to clear up is that it comes from both parents. One parent cannot give you sickle cell disease. Okay, so you're born with it, and your mother and father each contributes to you getting the sickle cell disease. Okay. It is another myth around the places that it is only seen in Black populations. That is not the case. Yes, there is a huge number of people and babies being born with sickle cell disease in Africa, but it is also very prevalent in India, which is where I was born, and other parts of the world, Mediterranean basin. And you will see with the globalization of the whole world now, that you have sickle cell disease all over the world. UK has a huge Caribbean population, so they have a lot of people with sickle cell disease, as does United States, Canada. So it is all over. Each color, people can look like any one of the four of us, and even different, and may have sickle cell disease. So it's genetic, it's chronic, is something you're born with it, and unless you are able to avail yourself of the relatively few cures that are available or might become available in the future, most persons are going to live with the disease throughout their lifespan, which can be very variable, and I'm sure we'll get to talk about that later on. The problem with sickle cell disease is, so what is a genetic thing? What do we inherit from our parents? We inherit things like the color of our eyes, or how tall, or how fat, or how our hair going to look, or how our skin going to look. Sickle cell disease you inherit, but each one of the patients living with sickle cell disease can have a different experience through their lifespan. Okay, babies as young as 4 months of age can start showing severe problems associated with sickle cell disease. I'm sure Kerri-Ann and Andrea will be able to say more to that. Okay. And there could be other people who never find out they have sickle cell disease till they reach their 30s or their 40s. They might just find out, either a woman might find out when she gets pregnant, okay, or somebody might be doing some kind of a medical that looks particularly for sickle cell disease, because it's a blood test that is needed to diagnose sickle cell disease. Okay, so
Doc, just a minute. So you said you can find out before the child is actually born that the fetus will have sickle cell disease.
It is definitely a possibility to diagnose what we call prenatal diagnosis. Okay, and there are parts of the world where they do this commonly. I won't say that the technology is not available in Jamaica to do it either, but it is not our standard practice to offer this to pregnant women. Okay, because what is the point of wanting to know if the baby you're carrying has sickle cell disease or not? There are countries in the world that will allow that couple to terminate that pregnancy. We don't practice that kind of science in Jamaica, so we don't routinely offer prenatal diagnosis, but it is definitely not a difficult process.
Okay. Okay, so we'll go over now to Chrissy. Chrissy's her pet name, but to Kerri-Ann. So Kerri-Ann, you are how old now?
I'm 42.
You're 42, and they told that your mother was told that you would have passed from age 3.
Yes.
Wow, God is good. So tell us a little bit about your journey as a sickle cell warrior.
Growing up as a child, I didn't get sick a lot. As a normal child, I would play, wet up in the rain, and have fun. But it was in my adult years I start to get sick, start to have a lot of
Yes.
crisis, low blood count, lungs
And when you say
infection,
you have a crisis, Kerri-Ann, what does that mean exactly? What is a
a lot of
crisis to you?
pain. Having a lot of
Okay.
pain. hmm And the real attack was in 2006 when I started to have chest pain. And from there, I found out that I have infection on my lungs. And I have to spend 1 month in the hospital and getting numerous blood transfusion to build up back my blood count. Another attack happened in 2009. Same thing. In 2013, that was my last attack with sickle cell disease. I tried to drink a lot of fluids, rest, and don't overwork my body. Because if I overwork my body, I will feel tired a lot.
So when you say you're in pain, it's what, bone pain? What kind of
Yes.
pain you
Most pains are in my joints. So if I'm having like pain in the chest, I will feel it like a burn. It starts off with a burnness, and then the pain come on more.
so can you sense or feel when you have an attack coming on?
Yes, my body
Okay.
feels funny.
Okay. Okay. All right, we come back to you, Chrissy. All right, so Mrs. Andrea Hall Brown, she's the parent of Shakira Martin, and she has a foundation called Shaq's Hope, which is in memory of Shakira Martin. I think Shakira had started it, and you took it over, and so she'll just speak to us as her with her experience as a parent of a sickler. So you can go
Well,
ahead, Andrea.
I
Welcome.
found out, hi everybody. I found out that I had sickle cell trait when I was pregnant. And the only thing I knew about sickle cell was the little bit that we learn in biology in high school. And I think because I ended up, finding out I had the trait, then her dad also had to be tested, and then he also had the trait. I took it upon myself to go to genetic counseling because I wanted to understand what it was and what I might be living with if my child, turns out to have the disease. Back then, they didn't have any kind of tests unless you were like 4 months pregnant. I think they do something called, is it an amniocentesis? I'm not sure. There's a test that they can do, but at that point, you're already like 4 months pregnant. In any case, she ended up with the disease, and I think she had her first crisis when she was about 4 months old. Shakira had sickle cell SS, which apparently is, they say, one of the worst types, because there's different types of sickle cell. I didn't miss any admission. I think when she was little, maybe she was admitted sometimes 4 times a year. There was a time when she didn't get sick at all. She was on medication, hydroxyurea, which is something they have for sickle cell patients. And a doctor told her off the record that I think you should take a break because of sometimes the side effects. But anyway, it just became increasingly worse as she got older. And I would say she was a true warrior. Shakira never, it's not how she died, it's how she lived. And people die every day, and it's a road we can't escape. But I think it's the way she lived that inspire other people. You know, like she wasn't the kind of person I could just go to the closet and feed her crackers. She would bungee jump, swim with dolphins, take planes, live in the moment. She said, what is the point of life if you don't live every day to the fullest? Because none of us, nothing is promised, right? So I think she had a really good life. Doing Miss Jamaica, she was a preschool teacher. So doing Miss Jamaica, I was like, she wasn't the most feminine girl on the block. So when she did it and won, I was like, wow. When she said, I want Sickle Cell to be my platform. And there's a great story about a little girl. She was 5 years old I think she was at the unit or at the hospital. And she was just sitting there with a picture of Shakira waiting, for her to come. And I said to her, this is what it's all about. You're teaching that little girl that she can be anything, including a queen. So that because you have sickle cell doesn't mean you can live a full life. It's just that it's very difficult. I mean, going and seeing how much pain I used to feel almost guilty, like I caused it, And the way I used to say to her, always respect people who take care of you and feed you, because people in the medical profession, there's not a lot of training when it comes to the diseases that are invisible. You know, if somebody's in a wheelchair but they're perfectly fine, people will say, "Oh, how can I help you? I'm so sorry," because this is what they can see. But you look like Shakira, you look like Chrissy, and they're like, "But you can watch TV, or you can." There's a lot of prejudice. There's a lot of, even in the medical field. I mean, I used to tell her, be kind to the nurses, but educate them. If they say something insensitive, it's all in your delivery. Say something, because that's how people grow and that's how they learn. Don't expect that because they've been medically taught, they know everything. You know. So she didn't suffer socially. Her admissions, I mean, she would have these people in the hospital bringing her all kinds of snacks, and we tried to turn it into like a trip. Being prepared, having what you need to make your stay more comfortable, doing the best you can. And so this is why in Jack's Hope, we had a meeting, I would say about 3 weeks before she passed, of our first event. And she was very specific in wanting to provide the feel good, in wanting to lift spirits. She always talked about how the little things that make are a big deal when you're in pain. So she said she wanted them to, patients to have pouches, and in a pouch would be very nice fragrance or lip gloss that, would feel good. Maybe snacks that don't have to be healthy, but just something. And always have a bag packed, because when that pain comes, Chrissy, it comes, right? And you don't know. Sometimes you're going out to a party and sickle cell has a different plan for you. And then here you are at the ER, or, in a lot of pain. So I was always there, every admission. We just did the best we could with it. And she succumbed to clots in her lungs. That's what.
And at what age? What age was that?
She was 30 years old. August will be 5 years, if you can believe it. So for me, I found that the service to others has been a great blessing, and it helps me to get through the day, by giving to others and supporting people here and in Jamaica. I wish I could do it like all the time, and do more, because I find even through this pandemic, it's how we have encouraged and inspired people. It is amazing, just the stories and the pictures from the treat. And you see that warrior up there, Chrissy? Let me tell you something. We would piggyback off the clinic because in Jamaica, they had a mobile clinic, and every month they would go to Mobay or and Black River. So we said, oh, let's do the treat at that time. And unfortunately, they had to stop it. And so we decided to continue doing it that time. So Christy created a chat with all the warriors in Mobay. And now we created one now for all the warriors in Black River. And we just wrote to them in the chat and invited them to come. It was great. I mean, in spite of everything, we did our social distancing, but it turned out really, really 2 good days. And I always say, if there's anything else we could do to, not just give things, but maybe reach out and help people that may feel depressed, because so much of it is mental. It's very hard. And maybe doing some mindfulness seminars or like art therapy, but just something else to kind of, so after that day and the week after and the month after, like how can we do something for the feel good? Because Shakira used to say you give your money to research and it goes to cyberspace. That's not necessarily true. But she just wanted to concentrate on lifting spirits.
So when Shakira would go in the hospital for a crisis, like how long would these? Oh, let me not ignore my audience. Good night, everyone. I see everybody saying good evening and good evening. Good evening, one and all. Welcome, welcome, welcome to Boss Lady Live. We are so happy to have you all. And remember now, you can ask questions. Any question, anything that you want to know about sickle cell. Remember, just ask. And and whoever can answer will answer. Yes. So how long would a crisis last for? And what we want to also find out from yourself and Kerri-Ann, like what is the cost? Like some of the costs of managing sickle cell.
I would say anywhere from 2 days to sometimes a week or so would be hers, depending. Towards the end, it was very complicated because of the clots, but that was the average. She had lots of blood transfusions. But we used to try things like lots of fluids, and a heating pad seems to help ease some of the pain rather than always taking pills, unless it was really bad. But yeah, about that, Chrissy, you think?
Unmute. Yes.
To me, drinking a lot of fluids is help with the pain more than to live on the medication, the painkillers. Because
how expensive is the medication? And is there, I mean, like for example, we have NHF. Does NHF help with sickle cell any at all?
Not all of the drugs the NHF card covers. Like the high-dosage drugs, yes, it covers some. Doctor put me on Panadine F for pain, but the NHF card does not cover it.
Okay. But the medication in general, is it very expensive?
Yes.
Apart from it can be very.
It can be very expensive.
And the hospital stays are long.
Repeat?
When you do have a crisis, the hospital stays are long.
Normally, if I get sick, I will spend a month in the hospital.
1 month.
Yes.
Wow. Okay, so Doc, let me go back to you now. Are there different types of sickle cell disease?
Definitely. But Sandra, if I may, because there is work happening with sickle cell disease, especially in Jamaica, we are really proud to be working so closely by the sickle cell unit at the UWI where I work, and it's the one sickle cell provider clinic in Jamaica, and most of the English-speaking Caribbean doesn't have a center like that. But really proud of the work that Ministry of Health and Wellness has done, and Kerri-Ann and even Andrea might not even be aware yet, because Kerri-Ann did say that sickle cell is covered under the NHF, right? As of 2015, after a number of years of working with NHF and to the Ministry of Health, sickle cell was finally approved to be added to the NHF list of chronic diseases. But as recently as a few days ago, prescriptions that are written at the sickle cell unit where a large number of patients are seen. So remember, once a patient with any illness attends any public health care facility and gets a prescription through a drug serve, they should be able to access most of those things once available free of cost. We know that. Prescriptions at the unit where a large number of patients are seen never used to have that, because we're not quite a public health facility. We come under UWI. But just about a week or two ago, we have now been approved that any prescriptions that are written by us can be taken to a drugstore pharmacy, and they can get the medications for free of charge once they're available. Yes, it is really good news. And the second good news that happened in 2015 as well, so two good things happened in 2015, was that every baby being born in Jamaica in the public healthcare system, the private hospitals are not coming on, but in the public healthcare system, every baby is being tested for the presence of sickle cell disease, because as we said earlier, so if you know friends, people, anybody listening has a baby born at a private facility or at a clinic and just didn't get tested, they can get tested, okay? Because the sooner you find out, the better you're able to manage that baby. Andrea said her baby started having symptoms from 4 months of age, even though Kerri-Ann had it later, and that's what makes the disease difficult. So we want the illness to be picked up in infancy, at birth if possible, because we can do a number of things and simple interventions to make it better. Your question to me was, are there different kinds of sickle cell diseases? And Andrea mentioned SS as well. So yes, sickle cell disease is an umbrella term for a number of different types of sickle cell diseases. SS disease is the commonest kind in Jamaica as well as throughout the world. About 67 to 70% of sickle cell disease is SS disease. Okay. After that comes the SC type of sickle cell disease, and then there are various others. S-beta thalassemia, which is a combination of sickle cell and beta thalassemia. Those are less common. Now the SS is the commonest, and along with the S-beta zero thalassemia, which is not so common, but we see quite a few of them as well, are the most severe. They're called sickle cell anemia as well, okay? But the SS is the commonest and one of the most severe types of sickle cell disease. SC tends to be milder. Having said that, is only one man above who determines how severe whose life is going to be, because we have many SS patients who do well, and many of the milder, so-called milder diseases like SC who do badly as well, okay? So it's important to find out if you have sickle cell early in life, as a baby at birth if possible, and start the treatment, and so that you can look out for problems. You can know immediately, oops, is this sickle cell causing this problem that my baby is feeling? Or this fever, is it complicated by sickle cell? I wanted to mention one important thing as I heard both Andrea and Kerri-Ann speak, because you asked a very important question. How long can a crisis last? It is very variable, okay? But a crisis may last for 2 days to 14 days, okay? A lot of persons may not understand that, okay? So you can have severe pain, and if you measure that pain, it may be 10 out of 10. Kerri-Ann, when doctors say how bad is the pain, sometimes a patient will say, doc, it's off the charts, it's above 10 out of 10, all right? And Sandra, if you don't have sickle cell, and I do not have sickle cell, I know that, I don't know what that pain feels like.
Right.
right? Because my patients have said that, doc, I've had a baby and that delivery pain is nothing like sickle cell crisis that I can get. But it's important to know that a sickle cell crisis can last long, so that you continue to take, you don't say, oops, my pain is better in a day, and then we stop taking medications, or you don't get enough of a prescription, or you stop drinking fluid. When Kerri-Ann says that she can be in the hospital for a month, what is happening there usually is that she might have gotten a pain crisis which put her there, but after that, other complications can set in. A common complication is what patients call the chest crisis, which is really what we call acute chest syndrome, and that's a very severe problem. Or you can end up with what Andrea is saying happened to Shakira, that with a severe pain crisis, you can get clots blowing off to the lungs, and that can be fatal, as what happened with Shakira. I want to say one more thing, because I'm so passionate and I worry so much when people don't understand pain. So generally, Sandra, what do we think about pain? Shaman, you can't deal with a little pain. It's just period pain. Or so what if you get a little lick? And I tell people when we speak to healthcare professionals, doctors, nurses, others who look after patients, sickle cell pain is not like you get hit by a car and break your leg. We can understand that and fix it. When a sickle cell patient says, I'm having a pain crisis, it means their sickle cell is acting up. And I don't even want to get into what that means, because there's such a complex array of problems that are occurring in your blood vessels and your whole systems. It is very complex and it can be very serious. Any pain crisis can turn complicated. So patients, families, doctors, all healthcare providers need to take all of this seriously. Listen to the patients. Even if they're smiling, believe the pain. When a patient says, I have pain, doc, how bad is the pain? 10 out of 10. If Kerri-Ann is smiling and telling me that, I am not to say, Chaman, so you can be smiling if you have 10 out of 10 pain, right? And only a person who doesn't have sickle cell would say something like that, because as I said, you and I don't know what that pain feels like. So we need to listen and hit it hard.
Okay, so if I wanted to say what are the symptoms, like maybe in a baby, then when a child is born, what are some of the symptoms that I could expect to see if my child has sickle cell?
Yeah. So the only way to know that we have sickle cell disease is to get a blood test. Okay, but suppose a baby misses newborn screening, and as happened up to 2015, every baby was not being tested for sickle cell. Okay, usually the first symptom a baby may show, and we'll see what happened with Shakira, is what we call dactylitis, a pain crisis in their fingers or toes. You may see that the baby's fingers look swollen and painful, and the babies can't tell you they're having pain, but they'll be crying, they'll be not feeding, those kind of things. So painful, swollen joints. And the second thing is fever, any kind of infections. Because sickle cell, two important things. You're anemic, which means your blood counts are typically low. Sandra, you probably know what non-sickle or regular blood counts are supposed to be, maybe 12 to 14 in women, 14 to 16, 17 in men. Sickle cell patients, especially the more severe types, SS, S beta 0 thalassemias, their hemoglobins can be, and let the ladies tell us how much it can be.
5.
Okay. Kerri-Ann?
Kerri-Ann?
5, 6. How much can be hemoglobin?
My hemoglobin is at is normally 7.2, but having a low blood count normally is at 5, but now it's at 6.
So you see what I'm saying?
Yes.
Right? Yeah. Yeah. Typically they may range from 7 to 8, but with a crisis it can drop lower. And so they're already at a very low, which means your whole system is weak, your immune system is also weak, and you're more prone to infections and so on. So with a baby, that is it. Okay, you may end up with that. But if a doctor or a parent is not astute enough to pick up, hey, let's test for sickle cell, it may go missing. And then that baby may not benefit from the few things we can do
Yes.
to manage them.
Okay, so Mark is asking, can I have sickle cell disease, HBSS, and still remain asymptomatic?
Absolutely. We said that earlier in the program, Mark. That is, what makes it so variable. That you can have SS and you can be asymptomatic till you're picked up on something, or the first time end up with a crisis at age 40 or 35. Little uncommon, but it is, we have seen it, and it is a very variable disorder. We are not taking for granted.
Okay. Kerri-Ann,
Yes.
do you have a special diet that you follow?
Certainly. I mostly eat the green vegetables, leafy vegetables. My mom would like blend the bush cabbage along with the papaya and give me to drink. And
Mhm.
she always put coconut water with it.
Okay. So,
So
so you are you a vegan? You do you eat meat any at all?
yes, I eat meat. I eat meat,
Okay.
but I'm trying to cut off the chicken and stick with the fish and the vegetables.
Okay. Was Shakira on any special diet, Andrea?
She used to juice every day, but and they never ate. She never had meat. Like she had chicken and fish, but never consumed meat ever. Red meat. But she drank juices, but she had her vices.
Okay. Now, is there anything that can, in terms of eating, that can give you a better chance at managing sickle cell?
Yeah. So a balanced nutrition. So there's no specific foods that you must eat or must not eat. But a balanced nutrition, even though it sounds kind of cliche, because every doctor talk about balance, is critical for managing sickle cell disease. So as I said earlier, with sickle cell disease, your blood counts are low. And you know where your blood is formed or made. The factory that produces blood is in the marrow of your bones, right? The inner
Right.
soft part of your bone. Like when you break the bone and you see the little soft part that some people like to suck out. That factory, because these patients are anemic, is working overtime to produce more and more blood cells to try to keep up with the supply that's needed. When you get a crisis, that need increases even more. So it is critical that through nutrition, you put back what the factory needs to produce those cells. Very importantly, Kerri-Ann and Andrea have said vegetables are very important, fresh fruits and vegetables, because they especially have the minerals and nutrients that are very important. For example, they give a large amount of folic acid. Factory needs a lot of raw materials to produce a lot more blood cells. Okay, so fresh fruits and vegetables are needed. You will notice, Sandra, people might see that a lot of sickle cell people tend to be slim. Okay, again, because their bodies are working overtime, on other activities, producing more blood and so on. So they need proteins, good proteins. So you hear about good fish or chicken is fine as well, but you need your protein. Get your calcium, all of those. Balanced nutrition is the most important. And the next part important, which Kerri-Ann keeps insisting on, is fluids.
What about supplements?
I'm a GP and I'm not a supplement doctor, okay? Because we also, where I work at the university, the other unit there has done work on nutrition, and worldwide, they are world renowned in their nutrition work. And what I've learned working at that institute for the last 18 years is that the best nutrition you can get is from your food. I'm sorry, it's going to kill a multi-billion-dollar industry, if anybody's listening to me. But But the best way to access the nutrients that the body needs is coming through food. When you take it through pills or capsules, it's not as effective. However, a lot of patients will be placed on folic acid because especially when patients get sick or have a crisis, they don't eat well. The appetite goes, they need more and they're eating less. So, or somebody gets a chest crisis or ends up in the hospital for a month, then we'll definitely give them some supplements. Iron is to be avoided unless certain tests are done. A lot of people think, well, I'm anemic, so I need more iron in the blood. That is not so for sickle cell. Okay, if we have time, I'll tell you why. But
Yes.
we do
No, go ahead. Go ahead.
acid.
You can just address it now. You can
Why
just
we
go ahead
don't
and address it now.
what is happening with sickle cell is that, so if I look at Kerri-Ann is looking good today. Are you well today, Kerri-Ann? Because I can't look at you and
Yes, I
tell you.
am. Yes, I am.
So if Kerri-Ann is well today or has been well in the last week or two, if I look at her blood under a microscope, it may look just like my own, or it may have just a couple sickle cell here or there. But when she gets into a crisis, it means a large percent of her red cells have turned into a sickle shape. Instead of the round donut shape, they turn into a sickle or a banana shape. The
Okay.
shape is not the only thing that matters. That cell is now abnormal. It dies very rapidly, whereas my red blood cell will live for 3 to 4 months. That sickle red blood cell may not live for more than 10 to 20 days. Okay? So it dies
Oh.
quickly. And red cells have the iron in it. When red cells die or break up, that iron is released from them and gets stored in the body. Body cannot get rid of iron. In fact, patients with sickle cell, if there are some patients who need a lot of transfusions, blood transfusions to top them up when they undergo certain crises. Kerri-Ann had said she needed many blood transfusions sometimes. There are some patients who need a lot of blood transfusion. In fact, for them, we have to give them particular medications to try to remove the extra iron from the body. Long
Wow.
story short,
Did
sickle
not know
cell
that.
people don't know. A lot of people think you're anemic, so let's go for iron. But it is not iron that is causing them to be anemic. It is their sickle cell that is causing to be anemic. And most of them do not need extra iron. But we may give them folic acid, which is one of the minerals that the body needs to produce more blood cells if they're not getting enough from their diet.
Okay. Gwendolyn is saying, please talk about the other complications of SCD. Example, early onset of heart failure, necrosis of joints, hips, shoulders. I know Shakira did a hip replacement, right, Andrea?
Yeah.
Yeah.
She did. Can you hear me?
Sorry? No, I'm not hearing you, Andrea.
I don't know. Still
Yeah, I'm
can't
hearing you
hear
now.
me?
I'm hearing you
Okay.
now.
Yeah. During her Miss Jamaica, she had a hip replacement, the last part of it. But she was pretty lucky because the scar was the size of her index finger, and she walked 10 times better than she did. But she was in Jamaica, and the doctor knew right away without even examining her what it was. She just was at the beach, and all of a sudden she started to limp. It's simple, something simple as that. She didn't fall, she didn't hurt herself, but that's a part of it. I know sickle cell patients here have it in your shoulder. Yeah.
So definitely sickle cell. So you're talking about the necrosis of the joints and the large joints, especially the hips, because this is a weight-bearing joint, can get necrosis. So recurrent pain events, because the commonest complication or problem it gives patients. Over 90% of patients with sickle cell disease will have severe pain events. Once in their life, twice in their life. Some people will have it every month. Some girls may have it with every period, okay, because there are different stressors that can cause it. And recurrent sickling attacks to these bones can cause damage of those bones, okay? So necrosis of the hip or damage to the hip joint or the shoulder joint can really cause problems. Now, not every patient is going to get All these complications or any of these complications. Some patients may get leg ulcers. Some patients may get hip problems. Some patients' kidneys may, and I'm really sorry you got to read all of that I wrote on my CV. I shouldn't have sent you that. Karen said you would cut it down. But kidney disease is a big problem, and Gwendolyn is asking about heart problems. So Sandra, patients with sickle cell are living longer. Thank God. It keeps
I was
us
going
on
to
our
ask
toes.
you, where did we get this that because from I know about sickle cell, I've been hearing that sickle cell persons don't ask 30. That's usually the age that's bantered about.
So
So what has changed?
Kerri-Ann
What
told
has
you,
changed?
Kerri-Ann told you that her mother was told she won't live to 3 years. So you will hear people say, my mother was told you're not going to live to 20. So I never got a study in my school. Okay. Now let me say something. Lifespan has increased. Okay. And I'll tell you why. But I want to make it very clear, we cannot take this disease for granted. That's why we want to pick it up at birth and start managing, because we know we can do a lot today than we could 30 years ago. And we continue to learn. Research in management of sickle cell disease is rapid and ongoing globally, okay, including Jamaica and the Caribbean. But babies may die in sub-Saharan Africa. So many babies die before the age of 5. Okay, there's no newborn screening or very limited newborn screening. A lot of babies die without ever being diagnosed. But we know sickle cell babies born in Africa, there's a huge amount of under 5 years mortality. Depending on where you live in the United States, the age, and UK, where a lot of therapies exist, and in Jamaica as well, we are way up there. Our median age to survival is about 45 years. Okay, but we have our oldest patient is 90 odd years. Mind you, that's a
Wow.
mild disease, SC, but I have had patients with SS in their 70s and 80s as well. Not a lot, but they are there. They are there up to now. But yet we will have children who pass away, or young, beautiful women like Shakira, because it can just, one complication, and before you can get a handle on it, everything is going downhill rapidly. It's kind of what's happening with COVID, right? But this is a COVID that we have been dealing with for over 100 years in the world. So a lot of treatment has come about that is improving the life expectancy as well as the quality of life of patients, Sandra.
Yes.
And that is why people are living longer and healthier. As people live longer, this is a chronic disease like diabetes or hypertension. Unfortunately, works a lot like hypertension and diabetes as well. It can cause problems to the heart, cause problems to the lungs, cause problems to the kidneys. Okay, babies, young children with sickle cell can have strokes. It's very rare to see children with
Wow.
strokes. And this is a very severe problem when a child, 6-year-old, 7-year-old, gets a stroke. Because once a child gets a stroke, they are very liable to get a second stroke, and their risk of getting a second and a third and a fourth stroke just keeps rising with each stroke. But we have treatments now that can predict if this child may get a stroke, and we can put them on treatments like hydroxyurea, which is what we do at the unit, and they won't get a stroke, or their risk reduces markedly. But as Gwendolyn was asking, yes, that is why it is very important for every patient with sickle cell disease, number one, to be diagnosed so they can get proper management. Part of the management is not just looking after you when you're sick. Kerri-Ann knows that. Part of the treatment is seeing you when you're well for your routine visits, so we can monitor your heart function, your lung function, your kidney function, and do something about it before they get out of hand.
Shireen is asking, are there symptoms if you carry the trait?
Good question, and I know Andrea had that question as well. So sickle cell disease, The disease itself is, as I said earlier, you get one gene from the mother. When we talk about SS or SC, one S is coming from mom. Andrea said she had sickle cell trait, and daddy would have had to have sickle cell trait for Shakira to get sickle cell disease. So one S from one parent, one S from the other, or one S from a parent and C from the other parent if you get SC. If you have only one gene, for example, like Andrea, who has probably AS, because AA is a normal hemoglobin, no sickle cell at all, right? But if you have the trait, you might be AS, for example, or you might be AC or A beta thalpa. We are going to talk about the sickle trait. You may have no symptoms ever. The only way to know is get tested. Our mantra, our advice, our begging for our country is everybody should be tested for sickle cell disease. But guess what's different? There are other diseases where we say, get tested, please, things like HIV. But there we say, get tested every year. Sickle cell is a one-off test. You don't need to get tested again. You get me? Because it is a genetic disorder. Get tested. With sickle cell trait, there can be issues sometimes, all right? Especially under certain severe conditions. For example, you go mountain climbing and you go to Mount Everest or something where oxygen levels are very low. When oxygen concentrations are low in the atmosphere, you can get sickling. And even sickle cell trait patients can get sickling. They may get some bone pains, or they may get blood in their urine. Okay, so it is important to know your status, and then you end up with a blood-looking urine, or you get tested. You say, you know what, doc? I remember when I was pregnant, a doctor told me I have the sickle cell trait, and then you put two and two together. But it is not a severe illness, usually for most parts, even though there are a few cases of sickle cell trait in athletes or so, which can give you sudden death. So under severe physical strain or so, you can get problems.
All right, Doc, another question. If you have with the same mother and father, you have more than one children, will all children end up with sickle cell?
Okay, very good question. Very good question. And I hope I can explain it properly. Otherwise, Andrea and Kerri are going to help me. So we take a case of a woman who is sickle cell trait, like Andrea, and her husband who has sickle cell trait. Every time Andrea and her husband get pregnant together, Andrea gets pregnant, there is a 25% chance that that baby is going to have sickle cell disease. Okay, and there's a 50% chance that that baby is going to have sickle cell trait, and a 25% chance that the baby is going to have no sickle cell, will be AA. With each pregnancy is the same chance. So Andrea and her husband, I'm sorry I don't know his name, can have 4 children who are AA. Or they can have one child SS, like Shakira, and 2 children AS. It can be any combination. You can have 4 children who are SS, because for each time you get pregnant, it is only the Almighty decides which egg and which sperm going to fertilize, whether that egg have the S or that sperm have the S. So you can have 4 pregnancies and all 4 are SS. You can have 4 pregnancies where none of them have SS. It is all a possibility.
Can I ask a question?
Yes.
How does malaria relate to sickle cell?
Excellent question.
Yeah.
So Sandra, this question that Andrea is asking, because there is science that tells us that in areas that have malaria, it affects what's happening with sickle cell. Malaria, which we don't have much of in Jamaica, is eradicated, okay? But it's there in Asia, India, Africa, definitely, okay? And it's a big concern in people who have sickle cell and get malaria on top of it, because sickle cell, to get any infection, we worry more, okay? When you have malaria in a population, Malaria affects the blood cells as well. But people who have sickle cell trait especially are not affected by that malaria much. Okay, so which means when malaria is rampant in a population, it's killing off more people who don't have sickle cell trait. So there are more people with sickle cell trait thriving and having children. Okay, so
Interesting.
sickle cell trait is protective for malaria, but sickle cell disease is going to do worse if they get malaria. And that's how the
Wow.
link is there with sickle cell trait and
Yeah.
sickle cell.
Because a place like Kenya, which is
Yes,
such a big malaria belt,
that's right.
right? They have tons and tons and tons of people with the trait, and they're
That's
just
right.
having babies with each other
That's right. That's
constantly,
right.
and they die very young, all the children.
That's right.
Yeah, because I
That's
have
right.
a friend that supports a family in Kenya, so I know.
That's wonderful.
Mishka Hamilton says,
Yes.
I have avascular necrosis diagnosed since 2008 and now it's real bad. Said my pain is horrible and I feel I'm going mad sometimes. So my question is, can sickle cell pain complication leads to insanity? Meaning
Mishka,
it's so bad that you lose your mind.
Mishka, you see me laughing, but I'm actually crying.
Yeah.
I'll let Kerri-Ann go first.
Um, Basically, when you have intense pain caused by the sickle cell, yes, you can feel like you're going insane because the pain is so terrible. So it's so hard to bear. So you can go insane. Yes.
For a moment, for
Yes.
that
Just for a
time,
moment.
for that period.
So Mishka, it can definitely, I guess, as we say in Jamaica, mad you. I can imagine because, so Sandra, as people are living longer, they don't only have what we call acute pain episodes. You get a crisis that's acute pain and it will wear off and we manage and wear off and hopefully not get complicated. But when you get problems like necrosis of the bones, till that is surgically corrected, that thing is always going to keep giving you pain. It's like, and it's a much milder version when those of us who don't have sickle cell say we get arthritis. It's chronic, okay? Chronic pain, and then they can get acute attacks on top of that chronic pain. So I can imagine it can almost mad you. But my plea is to not just my patients, because they are the ones who are actually suffering, but sometimes it's hard for even their loved ones and their families and friends to understand this pain. I have patients, more than one, more than 10, more than 20, who will say they don't want to tell the family because, they'd rather just bear this because they hear, all kind of things. What do you mean you get pain all the time? We don't have no time, or we don't have no money, because there's so much frustration with this chronic pain. And then the plea is to the medical healthcare providers, doctors, nurses, every one of us, to realize how severe that chronic pain can be. And if we don't deal with that necrosis part, then Mishka is always going to have pain because we haven't dealt with the root of that pain. There's much we can do for sickle cell, but when it's necrosis, then the next step is needed to be taken. Mishka, are you on hydroxyurea? You can message us if you want to say that. Andrea mentioned a drug called hydroxyurea. It is the only drug up to 2017. It was the only drug approved for managing sickle cell disease. And to now even babies as young as 9 months of age can be placed on hydroxyurea. It's a tablet which can be mixed as a liquid for babies and children, that's taken once a day, and it can be taken for years and years and years. We now have over 30 years data on it to show that it's really not going to give us, some of the fears are cancer, infertility, or those kind of things. But really and truly, I call hydroxyurea a game changer for patients with sickle cell disease. In the last 3 years, since 2017, there have been 3 other drugs that have been approved by the FDA for managing sickle cell, severe pain, and so on. Suffices to say that none of them are available in Jamaica yet. They are likely to be quite expensive. One of them is an injection that is taken once a month. And dairy, which is really like a vitamin, L-glutamine, is quite expensive as a drug as well. But hydroxyurea is a game changer. And every one of our patients who has any kind of moderate to severe pain, at least, or problems, should be placed on it.
Doctor said she was on it for a short time but stopped due to side effects. She said she don't think it works for her.
Mishka, we will have that conversation offline if we haven't had it. I do believe you attend the unit. There are a few people who are not able to tolerate it, but that's really few, and we don't give up on using hydroxyurea very easily. You get what I'm saying? We don't give up on using hydroxyurea because we know the benefits can be so huge. It can make a child grow normally. You can't look at that child. That child is not smaller than anybody else in their class. The child is not having pain. That child is not having hospitalizations, you know. So Mishka, I'm sure you have had a lot of conversations with your physicians. Feel free, call the office tomorrow, ask for me, we can have another conversation.
Can we have that number now?
I will give you, we can have that number. I'm going to give you
Yes.
the office number.
Yes.
It is 977-6151-22. Our lines were down for a couple of months, but they are back up. Okay. There's also an Instagram page, Sickle Cell Unit JA. Is that what it is, Kerri-Ann? Sickle Cell Unit JA. That's
Yes.
Instagram page. Dr. Leslie King is very active on it. And we will promise ourselves, all of us doctors also, to be active on it. But Mishka, you know we do our best to reach out to every patient and talk to as many patients as we can. That is our prime role in life. Those of us working through it.
Let me ask a question. Speaking, see how about the AFN, right? And even the heart failure. There's another patient, Shawana, that's really chronic. I think she's in the hospital every month. She sent me a copy of her lab report. So whatever the test is, it's not done in Jamaica. So they're sending it to Miami. And then the lab gets it back. And of course, that can't happen because of cost. So I guess that's the type of test. I don't remember. I can send it to you afterwards. But they said she has heart failure. Is what it is.
Yeah.
So I'm not sure if it's blood work or what.
Yeah. Yeah. I know the Support Foundation helps with a lot of those things. And Shwana is usually at Black River Hospital, as you said, which is a public facility, and there should be ways of getting tests. I don't know of many tests that we can't do in Jamaica that a sickle cell patient needs, but let me know. Let me know, and let any of us know. I'm sure, Andrea, you have my WhatsApp, or you have Nurse Harris's with the anti-propion test. There it is. Written it. Okay, but Central Med or Biomed do it, but they're probably saying they're going to send it overseas for the testing. I'm sure Biomed does it. Yeah, but they send it overseas. Let's see what we can work out. But that is just a test. I mean, a lot of the tests, if the diagnosis of heart failure is made, and I'm not a cardiologist, I'm not a heart specialist, which is who Shwana would be seeing, who would need to see her for her heart failure, especially if it has reached a stage where, you know, they're not able to balance or control it. NT-proBNP is a test to help in the diagnosis of heart failure. It's not going to change anything on her treatment as far as I know. So I'm not sure where the need is, but we can have a conversation.
Yeah. Okay.
Gwendolyn said it's 6,500.
Yeah.
Gwendolyn said it's 6,500 Jamaican. shipping plus
Right.
$156 for the test.
Right. So biomedical charges 6,500 or 7,000 for shipping. Any samples that they need to send overseas for testing, they will send it overseas for testing, and that's the shipping cost, which is pretty reasonable. And then the 156 is really the cost that the lab overseas would charge. You realize
Yes.
blood tests are extremely expensive in the United States. The blood test that we may pay a $2,000 for in Jamaica might be $100 in the United States or more.
That is
And
true.
those
That is
things
true.
yeah,
That is
yeah.
true.
Yeah,
That is
yeah.
true.
We
Before we
realize
go,
when
I
the
want Before we go, I want to touch on what about sickle cell warriors like Kerri-Ann. What about getting pregnant? Is there what is the protocol where when it comes to sickle cell patients having children?
let me
What
hear
is
from Kerri-Ann
the rule
first,
of
and
what is
then
the rule of thumb? What is the thought? What is the thinking behind it?
I have two kids.
Mhm.
I have two kids. When I was pregnant with my daughter, they said that I will not make it. I'm gonna die in childbirth, but I proved them wrong. And with the help of God, I gave birth to my daughter. I get pregnant again, and I gave birth to my son. I didn't have any complication during the
Any of them?
pregnancy.
Does any of them have the sickle cell disease?
The trait,
The trait.
yes.
Right.
so
Okay.
so so um, any patient who has sickle cell disease will never have a baby without the trait. They may have a baby with the disease depending on what the partner is having. But if Kerri-Ann is SS, then every baby she has, she's going to pass down a S2. Okay, so what Kerri-Ann is saying is absolutely true. So Sandra, a couple decades ago, 50, 60 years ago, women with sickle cell were told, don't bother get pregnant because you're going to die. Maternal deaths were high in women with sickle cell disease. What's the story today? Maternal deaths, because antenatal care, pregnancy care is so much more vast and available, and you know, we have a lot of good facilities in Jamaica as well. But this is our advice to patients with sickle cell disease, especially the more severe types of sickle cell disease, SS or S beta thalassemia. A sickle cell pregnancy is a high risk pregnancy. In fact, in Jamaica, it is called a high risk pregnancy because there are high risk antenatal clinics. And for people, women with sickle cell or women with heart disease who are getting pregnant, they go to even a more super specialized care because the risk of complications in pregnancy, getting more crisis, getting acute chest, getting problems with the baby's development, or even dying at the end of a pregnancy are higher than in a woman who doesn't have sickle cell. Way higher, 10 to 15 times higher. So that's a serious number. And I think it's important that our patients and families understand that. If you make a decision to get pregnant, be thinking about it and be prepared to take good care of your health, follow your doctor's visits, attention, everything. It is not a death sentence to all, or even most women who get pregnant will have, many of them will have complications. They might get more pains and get admitted in the pregnancy, but most of them will do fairly well. But every year in Jamaica, you will have a couple of sickle cell women who will still die with a pregnancy. So this is what the story is, okay? That there
Yes.
can be complications, and we just need to look out for them and be very aggressive. But most women will be okay.
Well, Antoinette says she was
Yes.
scared. God was on her side. She has two daughters. Well, Antoinette is 49. She has two daughters, and one has the trait. And she said she waited until she was 30 to have her first child.
There you go. That's why patient stories are the best.
Right. Gwendolyn says her cousin, who has SCD, has 3 children without the disease. She is 69 years old. Her children are in their 30s and 40s. She was told she only had the trait and has the SC variant of the disease?
So this is a very important point I want to say here. Gwendolyn has brought up a very important point. A lot of patients who have the SC type of disease, because it is another common. After SS, SC is the commonest type of sickle cell disease. And a lot of them grew up thinking, despite attending the clinic, despite being given and told they have SC, and I'm hoping despite being counseled about what this is, and attending the unit for visits over and over, they still feel they have the trait. The trait is something totally different. If you have SC type of sickle cell disease, you have a sickle cell disease. It might be very mild, and we are blessed if it is very mild. Okay, it is excellent, but you need to make sure you continue to be seen at the unit. There are some complications we need to look out for. Your eyes, for example, because sickle cell disease can cause blindness, just like diabetes can cause blindness. And the SC type of disease, we think might be more at risk of causing it than even the SS type. So it's important to continue. But a lot of SC are just like what Gwendolyn said about her cousin, do very well. And the children have to have a trait. Every child of that cousin has at least a trait, either the C or the S, and could be something else depending on what the father had. So they need to be tested. They should all be tested.
Doc, is there any fundamental difference between males and females when it comes to sickle cell in terms of what happens to your body?
All right.
Anything unique,
and that's a very
males
important question
versus
too.
females?
That's a very good question as well. Physical complications, the hip or this or that, okay? There is a complication that men get, is called priapism, and it's like in a simple words, it's a painful crisis in the penis. Women don't have a penis, so they can't get that. Other than that, most of the physical complications are the same. Men are not more predisposed to getting leg ulcers or acute chest or pain crisis or so. But let me tell you one thing. What women fare worse with, it is the psychosocial aspects of the disease. And we're having so much talk on the gender and gender related issues. And sickle cell is not the only disease, but a lot of other chronic diseases, outcomes may be worse in women. So a lot of the work I have done, as you read in that little convoluted CV, was psychosocial issues that people with sickle cell disease. And unfortunately, we are also picking up that even adolescents, the boys are having better quality of life than girls. Is it that our population, which is very son-centric, is giving more attention to our boy picnic than girl picnic? Are they getting more support from their families or even from healthcare systems? I don't know. But this is typical. Girls are having more psychological or social problems that are associated with sickle cell disease than boys are. And we really need to investigate why that is the case. And we really need to be able to provide that kind of targeted support to make sure the girls are on par with the boys.
What exactly is priapism, you said?
Priapism.
Priapism. What exactly is that?
So the priapism is a painful...
How does that present?
It's a painful erection of the penis, and this can start in boys as young as 6-7 years of age, when they don't want to talk about their penis or they'll be very ashamed of it, okay? But they get an erection, which again, a lot of boys of young ages may consider shameful, okay? They get an erection, but it is not an erection that is related to thoughts of sex or so. It is a non-purposeful erection, and it is painful. So I tell patients it's almost like getting a painful crisis in the bone, but this is a pain crisis in the penis. The blood flow in the penis is compromised. Blood doesn't flow properly at certain times, so they're getting a crisis in the penis. The penis stands up or is erect and comes with a lot of pain. And it needs very quick attention. If a boy or a young man with sickle cell disease is having a painful erection of the penis and is going on 2 hours, 3 hours, you go to a hospital. You do not go to a GP on the way. You don't go to a clinic. You reach a hospital because that erection has to be brought down. The sooner it is brought down, the better. If it goes on for hours and hours, it may cause infertility. Or not infertility, sorry, that's the wrong word. They may not be able to get erections and it can cause erectile dysfunction.
Sure.
Right? So it's not infertility. I'm sorry about that. That's a different issue, but it may cause problem with erectile dysfunction. So if your mummies, if you find your sons, because they might be ashamed to talk to you, but we as doctors ask them straight off, just like we say, are you having pain in your bones? We say, have you had any pains in your penis? Are you getting erections? Yes, doc. Are those erections coming with pain? Sometimes, doc, then we need to consider priapism. And if you have an attack, your penis is standing up and is in intense pain and is going on 3 hours, you reach a hospital, dead of the night, daylight, whenever.
But there's a patient that told me that in Jamaica that they take, which is interesting, Viagra for priapism.
For priapism?
Yeah.
Viagra has not been shown to have any effect on priapism, nor good nor bad.
Okay.
Viagra has certain mechanisms that we thought might help with other conditions like lung disorders and so on, but really hasn't held up to much promises. But it will not give you priapism, okay, and it will not reduce priapism. We do have a lot of work that we are doing in Jamaica on how to manage priapism.
Okay.
So there are drugs that we can use to help.
Tanisha is asking, hold on one second.
Yes. Does SC
present with a different set of problems than SS, such as retinal detachment?
So, Tanisha, thanks for that question. As I said earlier, even though SC tends to be a milder kind of sickle cell disease, there are some complications that we think may be a little more prevalent in those with SC disease, okay? And retinal problems is one such problem. We used to think that women with SC disease, that when they get pregnant, they might have bad outcomes compared to SS or worse outcomes. We don't think that is quite so. But because SC is usually so mild, you know, that definitely these problems are seen more than other problems. So eye problems, pregnancy can give you problems. The one problem that is severe in SC disease, let me tell you, is dengue. So whenever we have had dengue outbreaks in Jamaica, and we get a couple of our patients who might die with it, not everybody with sickle cell who gets dengue is going to die with it. The SC tends to do worse. And we have shown that in our research studies. And even with COVID going on now, there are studies coming out of Europe and so on, which may point, and remember, COVID is very young for science right now. We are learning about it as we go along. And there's some learning you can only do with time. There's no amount of bench studies or microscopes that can study what time can teach you about a disease. So it looks like SC can have worse outcomes with COVID than SS. But dengue we have shown, so we are very cautious with dengue when dengue season comes around. SC patients have to be very quick. So Tanisha, these are some of the problems to look out for. Even avascular necrosis, we think, has pretty high problems in SC disease.
Okay, so as we wrap, what I want from each of you, is there anything that you would like for us to know about? Or is there anything that a sickle cell warrior, I want to call him a warrior now, a sickle cell warrior should not do, should not eat. I think there's also a hot and cold factor where sickle cell patients, they are affected by what temperature, or just temperature in general.
Yeah, cold weather.
Cold weather. Okay. So I'll start with you, Doc, and then I'll go to you, Kerri-Ann, and then Andrea, you can let us know what Shack's Hope is coming up with in the future, what's on your agenda, and we close off with you. So Doc, I'll start with you.
Hi, Shelly. I see Shelly saying hi. Boy, Sandra, there's so much to say about sickle cell. June 19th is World Sickle Cell Day. Okay, for the last few years, the WHO and the UN has declared June 19th to recognize the public health burden that sickle cell disease causes. And I would, ask that we have more recognition of the problem. But what do I want to go away with? There's something we didn't touch at all, which was the stigma, which Kerri-Ann spoke to, and even Andrea mentioned. And one of the things that a lot of people think sicklers, which we do not use, that's a dirty word for us. We do not call our patients sicklers. Our patients are people who have sickle cell disease. Just like I tell my patients, like, I have myopia and I have to wear glasses. You have sickle cell disease, but the rest of you is just like you and me, everybody. All right. A lot of patients with sickle cell disease are considered to be addicts, because we spoke about how severe this pain is, Sandra. And this pain is not pain that you and I can understand if we don't have sickle cell disease. There's not much other pain conditions that give you pain of that severity. Okay, maybe urinary colic or kidney stones might give you that kind of intense pain, but that is so short-lived usually. All right, and so they need strong medications such as opioids, like morphine, to control that pain. Most people know opioids are used for like terminal cancer pain, but our sickle cell people might need to get a morphine thing even when they're 1 year old or 2, and they might. Some of our patients who get crisis every month, right, might have to use morphine for years and years. And a lot of them are considered to be drug addicts or drug seekers. And that is not the case. Please believe the pain, manage that pain properly. If you have true feeling that a patient may be getting addicted to this drug, let's work together to deal with that as we deal with other addictions. But most patients with sickle cell disease do not have addiction problems, and it is shown throughout the world with many studies. So what I want to say is, there's no stigma. You cannot catch sickle cell from anybody. All right, by hugging, kissing, touching, nothing. You can only get it from your mother and father at birth. All right, and they are not addicts, but pain is real, pain is severe, and pain can be very complicated. So the sickle cell patients have a huge cross against them because they have this lifelong disorder that can be severe. Let us not make ourselves, as communities, as families, as healthcare communities, let's not add more crosses to their lives by not believing. So I'll leave it at that.
Okay, one question I wanted to ask you, Doc, before you wrap up, finish wrapping up. Would you suggest, I mean, I know, I'm sure, I don't remember where I heard it, but I know some time ago, when persons were getting married, that was one of the things on the list of things to do when you were formulating a couple. Yeah. Now, those things are no longer in the planning. Would that be a suggestion for you, from you, for persons to check if they have the trait so they can plan better?
Absolutely.
When having children.
Absolutely. So one of the things I mentioned early on was know your status. Every young person, and not so young if you're planning to have your first baby at 40, know your status. And then what do we tell young people when they're getting into the ages where they might get a boyfriend or a girlfriend? We say, get your partner tested. And what do I say to my patients? So there are countries in the world where couples must get tested for sickle cell disease if they're planning to get married, and there are countries that will ban those marriages. Obviously, we don't do that kind of things in Jamaica. So what do I recommend to my patients? We don't determine who we're going to fall in love with, but we can make informed choices about having a child. You understand what I'm saying? If it is, we have a couple in our clinic and both of them are SS. Every baby they have is going to be born with what? Kerri-Ann knows. Has to have SS. So if I have SS and my husband has SS and we have 3 children, I don't need no testing. Each one of those children is SS disease. So, but know your status, know your partner's status, and make an informed decision if you want to go ahead and have a child together. It's complex, but I think people need to understand what it might mean to have a baby and a person to look after with sickle cell disease. I think knowledge is power, and they should understand that and make an informed choice.
Absolutely. Kerri-Ann, over to you. Is there anything that you want to let the world know about your challenges and what it means to have sickle cell? And if you and if you can motivate someone who's currently going through sickle cell, you know?
The saying always say, in everything that you do, put God first. For me, it's been an uphill battle with sickle cell disease, but I learned to put God first in everything that I'm doing. I try to follow my doctor's advice. I don't smoke. I don't drink. The only thing I drink is like a lot of water. I love water. And as Andrea said, that I should try the coconut water. Best, I drink the coconut water now and again. So, as a warrior, I like to say to my fellow warriors, don't give up. The pain may be intense. You may feel discouraged. You may ask the question, why me? But put God first in everything that you're doing. Take your rest, your medication. Don't stress yourself too much, because if you stress yourself too much, you're going to end up in crisis.
So you'd say that stress is a trigger?
Yes.
Andrea?
I love her, you see. No, she made me tear up because she's so inspiring. I mean, to think she's a warrior, but it's how she supports other warriors that I love and encourages them. And she's so positive all the time. You know, she always only says to me, I just wish they weren't so prejudiced against us. I wish they understood. Well, that's a battle and we're going to win it. Right, Chrissy?
Yes.
There's something I wanted to say before you go on to Shark's Hope, which we really want to hear about, Andrea. I wanted to say something to that. Thanks for reminding me. I want to reach out and on behalf of my unit and all of us who are working so closely with sickle cell, that I've said this over and over today, we cannot understand. We don't walk in your shoes. We don't walk in your shoes, Kerri-Ann. I don't walk in your shoes, Andrea. I don't have a child with sickle cell disease, okay? But we need your help to help you guys better, because you need to bring those issues more and more to our attention as well. We might understand the disease and the pathology, but we learn from you what are the next steps to take it further. So go ahead.
So because of the pandemic, you know, we've been limited even though we've done the 2 treats, but we are planning to launch the Shakira Martin Scholarship. And we're going to do that in September for Sickle Cell Awareness Month. I don't have all the details as yet, but I would really like to maybe see how we can gift 2 patients in Jamaica and how they would qualify. And here as well, because we support patients both here and there. So that's our plan. For now, that's it. But we just continue to educate and encourage people to know your status, be understanding, be supportive of somebody living with sickle cell. But again, as you said, Doc, the first question you should ask somebody, my name is Andrea, and I have sickle cell trait. Do you know your status? Early, because people say you can't help who you love, but you can have a choice about whether you choose to have a child that's gonna suffer and not you. So everybody has a choice for that. And however we can support the patients, let's just be understanding. It's a tough road for them and see what we can do. And I always encourage Chrissy, speak up. Let them know how you feel at the unit. Talk to them. You don't know what can be available until you put it out there. You don't. You just have to let people know and continue to let them know. Again, it's all about delivery, how you say things to people. So that's it. But this was really good. Thanks for doing this and inviting us, Sandra. I mean, I really, it was a nice hour. It's been an hour, right?
Hour and a half. Hour and a half. Believe it or not.
We chatted away. I didn't even realize
Andrea, can you give us your social media handles?
Yes. So you can follow us at Shack Soap on Instagram, and we also have a Shack Soap page on Facebook as well.
What about the sickle cell unit again? Can you give us that again, Doc? Unmute.
Sickle Cell Unit JA. That's Instagram.
We are both on Instagram and Facebook.
No, we are not on Facebook, I believe. Kerri-Ann, we are not on Facebook. No, we are on Instagram, and a lot of messages go out on Instagram, especially during COVID. That has been our one means of communication, because we have kept the clinic open, or we have tried to keep it open every single day, even when university is closed. We have tried to keep it open. But Sickle Cell Unit JA is our Instagram page. You have our numbers. On the care website, we would have our presence as well. Our numbers would be there. Reach out. Most of patients and families can find us easily enough. We'll be happy to speak.
Wonderful. Well, Doc Asnani, Kerri-Ann Sanderson, Andrea Hall Brown. It was indeed a pleasure. Respect, gratitude, everything. I mean, may God richly bless all of you. You are doing a fantastic job, Professor. Andrea, you're doing a fantastic job. Kerri-Ann, you're an awesome warrior and an excellent supporter to your fellow warriors. I am so blessed to have had the three of you on my program this evening, and my audience are very happy as well. They are saying so much information, Doc, well spoken, clear, very informative, in a very concise way that people can understand. And really and truly, Professor, I can feel your passion.
Yeah.
It's very, very rarely you get that passion. I'm not saying that doctors are not passionate, but it's very, very rare you can feel it. I actually feel it, and that in itself is a blessing. So I know you have found your calling. I know you have found. That's not a guesswork. Yes, I can see it. I can feel it. So I want to say thank you to Karen, because Karen was the person who I hit up first, and she made a connection with you. So I'm very appreciative, Karen Aldred as well. And Andrea, continue to do the work that you do, you and your fantastic husband. Paul, big up. Paul, big up yourself. and Kerri-Ann continue also to do the work. My audience, thank you so much for joining me once again on Boss Lady Live. It has been a pleasure again. I learned so much tonight.
Hold on, boss lady. Boss lady,
Yes.
I must say thank you to you as well, because
Yeah.
you have reminded me that, this is not Sandra's first time with Sickle Cell. At least once or twice you have been interacting with our teenagers at the teen camp, and I was there and I listened to your story when you were the guest speaker at the opening last year, the year before, I think. Last year, we might have been virtual, I can't remember. But thank you. I mean, I said to Karen, how come Sandra wants to talk about sickle cell? And here we are. I really appreciate any time we can get our voice, the doctors, the patients, the families, and you have brought it all together. Thank you and bless you.
You know, wherever I can help, I'm available, because really and truly, this is why we are here on planet Earth, to help each other, to share our knowledge, to use our platform to inform, because my mission is for a better Jamaica, period. So for better, for worse, I'm there for Jamaica. Next week, we are going to be speaking on autism. So next week is another big week. So I want you to join us next week as we talk about, next week we'll have a specialist in autism, and we'll have a mother who has an autistic child, and we'll have a teacher who tells you how to manage autistic children into adulthood. So next week is also going to be very exciting. So thanks again, one and all. God bless you all. And, have a fantastic week. COVID or no COVID, life still a keep, right? So mask up, social distance, but don't lock up yourself in the house. Social distance, take a little time, do a little thing every now and again, but within COVID and within COVID curfew time. Do not disobey curfew. So I wanted to say thanks for everybody. Have a good night. See you next week, same place, same time. Don't forget to subscribe to my page. A lot of information is on my page. We have done over 35 programs, so there's a whole heap of information there to get. So see you next week. Thanks again. Good night. Love you all.
Bye. Thank you. Take care, everyone.
All right.